Hello, I'm John Lewis with ACRO. I'm joined today by Tony Coelho and Sara van Geertruyden of the Partnership to Improve Patient Care. Tony is the chairman of the organization and Sara serves as executive director. Welcome.
Thank you, John.
So the Partnership to Improve Patient Care sounds like a kind of broad organization, but you actually have a very specific focus. Can you explain what PIPC is all about and how you started?
Well, PIPC is an organization made up primarily of patient groups, because we're a patient-oriented organization, but it's also made up of a diversity of groups. It's doctor-oriented groups, it's pharma, it's device groups, and so forth. And basically, it's an organization to make sure that that we keep focus on what the Congress wanted, to make sure that PCORI did what it's supposed to do, and that is to make sure that we brought the patient point of view into research. And we haven't had that in the past, and that's what PCORI is supposed to be doing, and PIPC is just keeping an eye on that to make sure that it happens.
Now, PCORI is the Patient-Centered Outcomes Research Institute that was enacted through the Affordable Care Act, correct?
Right. Yes, sir.
And prior to that, the government had done some of this type of research through the NIH and through the Agency for Healthcare Research and Quality, and then in the stimulus bill. But this was really the first big movement to make it patient-centered, which is kind of a hard to define term. Can you give us your definition of patient-centered?
Well, I think the Affordable Care Act did that. When they told PCORI to conduct research that focused on patient preferences, patient needs, patient outcomes, that was the definition of being patient-centered. I think defining it isn't hard; it's doing it that is apparently a little more difficult. And I think, but that is what distinguishes PCORI from ARC and NIH, is they're guided by Congress to be patient-centered.
And I think the other distinction is that NIH and ARC included patients, but only from an advisory point of view. You're on these advisory councils, but you're outside the room when the decisions are made. And PCORI basically is that you're inside the room, you're at the table, you have a vote, you're helping to make decisions. And that's the difference. And so we want the vote at the table, not only to help make the decision, but to exchange votes. When you have a vote, you have power. And so you make decisions along with others as to what should or should not be done. And the Congress intended for PCORI to be patient-focused, patient-oriented, and that is a huge distinction. The first time in the history of the government that the patients have been at the table.
Now, Sara, on that point, I think you've recently been named to the advisory panel on patient engagement at PCORI. Can you fill us in on your role there and how that's progressing?
Sure. PCORI chose 21 people from around the country to serve on the Patient Engagement Advisory Panel. We have met once now in person. We have another call this week, and the purpose of that panel is to help PCORI with its processes related to patient engagement and to make sure that they are engaging patients appropriately and at the right times. And so they've been taking our recommendations as to how to do that.
I think it's kind of universally acknowledged that PCORI got off to kind of a slow start. How are you seeing their progress now?
Well, I think they were sort of influenced, like NIH and ARC, that the researchers sort of made the decisions and so on. And they're slowly moving towards being more patient-focused, more patient-centered. I think they're making progress. We were critical at first, but it's been a great dialogue. We're making progress with them, and we're happy with the way they're moving. Slow, but the way they're moving. And hopefully over the next year or so, that progress will continue. We're in the midst of doing these roundtables with doctor groups that have been very productive, and a lot of the doctor organizations have not had the access with ARC and NIH that they would like. A lot of that research is done by these researchers in their ivory towers, and the research that is done is something that the patients can't understand or read, and a lot of the doctors can't understand as well. So a lot of that research is not of great value to us because we have to have somebody from the ivory towers interpret it for us. So now what PCORI, we're trying to get them to communicate better with patients, to put it in language that we understand, and also to disseminate it better. And so this is now starting to happen and to better understand it. It's been difficult to get the research community types to understand that that's a real basic problem. And we're making some progress on that. These roundtables, getting the doctors to work with PIPC to point out what the problems are, has been very productive. And now we're getting a roundtable with the different disability groups to understand what their problems are, our problems, what our problems are, and to try to communicate that to PCORI.
Now, on the cost issue, and I'm glad you brought that up. That was one of during the debate and the formation of this, that was a controversial point, and PCORI is not, it's my understanding, not really allowed to focus on cost, but it's, I think, most people's assumptions that when you have better evidence and better understanding of what works, what doesn't work, it should naturally lower cost. Is that accurate?
Yes. I think the issue here is that what all of us were concerned about was that I have epilepsy, and I'm very involved in the disability movement, is that, for example, with epilepsy, there's 15 different drugs. What we don't want to do is to have PCORI come in and say, well, the most common drugs are 5, and the other 10 go by the board, and that's the most cost-effective way to treat epilepsy. Well, what about the rest of us who have to use those 10 to handle our particular seizures? That's what I think all of us were concerned about with devices or drugs or whatever that would happen if you got into cost effectiveness.
Right.
And so that's what the Congress said, stay away from that. But if you take, for example, what I just used, if you can find ways to cut down on the cost of health care by examining everybody who comes into a doctor's office, you might then find out what the problems are, and you cut down the cost of health care that way. That's what they should be doing.
So if we'd like more information about PIPC, where would we find that?
You can follow us on Twitter at PIPC Patients or go to our website, pipcpatients.org.
So for more information about ACRO, please visit us at acrohealth.org or follow us on Twitter at acrohealth. Thank you.